Thank you for coming. I have information for you, research actually, that will enhance your resilience, increase your vitality, and literally change the way your life unfolds. I graduated from dental school in 1985 and have enjoyed a private practice, a clinical practice, since that time. Now, it was against the recommendation of my college advisor that I went to dental school. He recommended that I apply to medical school, but I was absolutely terrified at the thought of dealing with serious illness or disability or death, and dental school seemed so much more benign. But after 33 years of clinical practice, I have learned that what happens in the mouth absolutely impacts disease, disability, and death. And I am no longer afraid to talk about these issues. So let me tell you what I found. The average lifespan in the United States is 79 years, but that's not the entire story. Health span is a much more relevant number, and it's a number over which you have much control. Your health span is the number of years that you have energy, that you feel like running and playing, that you are unhampered by chronic illness. Now, this number is currently calculated between 63 and 69 years, and it's decreasing. That means that there is a 10 to 16-year gap during which the average person spends time, energy, and lots of money dealing with chronic illness. Now, my clinical practice has been my front row seat to life. It's been my observatory of the habits and the behaviors that both increase or decrease this healthy lifespan. Although people are living longer, they're not necessarily living better. And I have observed that those people who maintain healthy gums that absolutely don't bleed, enjoy a much longer and more vibrant health span than do people who ignore these problems. So that sparked my interest to go back to school about 4 years ago. So I went through Mayo Clinic's wellness coaching program, completed a fellowship in anti-aging medicine, and then a master's degree in metabolic nutrition from a medical school. Now, I learned that these illnesses that dominate this gap neither have one specific cause nor one specific solution, but they all involve chronic inflammation, which makes a lot of sense because chronic inflammation accelerates aging in every single part of the body from head to toe. I also learned about remedies for these chronic illnesses, not just medications or supplements, but also things like nutrient-rich food or restorative sleep or stress management, digestive health, even social connectedness, and much more. But curiously, through all of this excellent education, the impact of gum disease on chronic inflammatory disease was rarely mentioned. It's as if the mouth was this isolated orifice, totally separate and detached from the body. But I had seen in my clinical practice that that wasn't true. So consequently, I coined the term the forgotten orifice, and that became the name of my master's research paper. Paying attention to something this simple will absolutely change your life. Think of bleeding gums as the canary in the coal mine. Now, early miners would take a caged canary deep into the mine shaft to monitor air quality. This canary was merely an early warning system for a much bigger event. Bleeding gums, too, are an early warning system for a much bigger health event. Now, we know that gum disease can lead to tooth loss, but we've known that for decades, but now we know that it's also an early warning system for much bigger health events throughout the entire body. So what does the research have to tell us? When I started looking all of this up, there was absolutely an avalanche of excellent research from all over the world. It was astounding. And these were not just rat studies. These were like peer-reviewed people studies. It was so exciting. And heart disease was the first area of oral systemic research back in the late 80s, and that connection's well established. We know that these bad bacteria that originate in the mouth, that live and reproduce under the gums, affect all parts of the cardiovascular system and have even been found live in the carotid artery. Now, Treponema denticola is a bacteria that's pretty common in gum disease, even early gum disease, and it was isolated from 25% of diseased blood vessels, but was found in 0% of healthy vessels. So how does gum disease or bleeding gums impact your cancer risk? It's now well established that many cancers have an infectious component. And according to the National Cancer Institute, chronic inflammation is a critical component of cancer progression. So in other words, chronic inflammation anywhere in the body makes tumors grow faster. Fusobacterium nucleatum is an extremely common bacteria in gum disease, and it's been isolated from frozen segments of colorectal cancer. Now, does this Fusobacterium start it or just make it grow faster? We don't know for sure yet, but we know that we thought it was only in the mouth, and now we know it's at distant sites. And we know that bleeding gums signals chronic inflammation, and that's absolutely making it grow faster. So how many of you all know somebody with type 2 diabetes? This is no longer just an old person's disease, but it is epidemic in children and young adults. These bacteria that live and breed under the gums accelerate insulin resistance. Now, insulin resistance is the hallmark of prediabetes as well as type 2 diabetes. But now we know it paves the way for other problems like dementia, like liver disease, and like many cancers, and weight gain. It's very hard to lose weight if you're insulin resistant. And maintaining healthy gums is a really smart strategy just for controlling your blood sugar. It starts here, but it affects everything here. Is it safe to get your teeth cleaned when you're pregnant? Absolutely. It's a super smart strategy for a healthier baby. 80% of infant death is due to low birth weight and preterm birth. And Harvard University published a report that bleeding gums, gum disease in pregnant women absolutely is associated with these problems. What do you think about maintaining healthy gums as a pain management strategy? Now, Hippocrates, 2,000 years ago, observed that arthritic pain could be decreased by removing an infected tooth. And now we have been able to isolate a bacteria from under the gums from the fluid of inflamed joints. This bacteria is called Porphyromonas gingivalis, and it's routinely found in the fluid of inflamed joints. So think about the fact that 50% of people who are diagnosed with RA are unable to work within 10 years. And studies show that people who maintain healthy gums report lesser arthritic pain. That's a pain management strategy with no side effects. Very exciting. So how do these bacteria that live under the gums affect cognitive decline? We know that they attack the blood-brain barrier. Now, the blood-brain barrier is this protective barrier, this filter that, when compromised, allows toxins in that can cause other serious brain diseases, most of which cause memory loss. Memory loss is troubling for many, many reasons. It has much impact. But one of the things about memory loss is that it impacts social connectedness. And research study after research study after excellent research study has shown us that social connectedness is absolutely a key for a long health span. Poor Ramonis gingivalis that I mentioned earlier was isolated from 40% of the brains from people who had died of Alzheimer's disease, but from 0% of people who died with full mental function. So this is just the tip of the iceberg, but you get the picture. It's DNA technology that has allowed us to start to learn so much, and we're really just on the threshold. But it's absolutely incredible. So who's at risk? Everybody's at risk. I'm sorry, I can't let anybody out here. The thing about these bacteria is that they cause bleeding, and we easily dismiss bleeding, we ignore it, or we minimize it. And gum disease is mostly silent and painless. Also, several of these bacteria are transmissible. They are contagious. That means they can spread through saliva. But more accurately, think of these bacteria as transkissable. That means that if you kiss somebody, or you drink after somebody, or you take a bite off of their fork, or you use their toothbrush, don't do that, you will spread these bacteria. They start here, but they go everywhere else. So what do you do about it? I have 3 start somewhere solutions that are pretty easy for anybody to tackle. Number 1, find a dental office that you can communicate with. Now ask them where your gums bleed. Be your own health advocate. Ask them to screen you for gum disease. They want to help you and they know how. These bacteria live in a protective biofilm, and they don't go away simply with antibiotics. You have to get your teeth cleaned. The second thing is to find tools that work in your hands. It's different for everybody. For some people, it's floss, but for some people, it's brush picks or a toothpick, or even in developing countries, it might be a handmade chew stick. But this is 90% of your solution, and it can really expand your health span. You have to do your homework. Even if you have the best dental office in the world, you have to do your homework. And third, share this life-saving information with those people that you care about. Encourage them to address their own forgotten orifice. But also be aware that everybody has to take responsibility for their own health. You can love somebody to the end of the earth, but you cannot make them want to be healthy. But don't drink after them if they're not going to do that. Because gum disease affects 80% of the global population, I am convinced that it is the most underdiagnosed, undertreated, communicable disease in the world. So let's start a revolution in healthcare by addressing the forgotten orifice. The answers to enhanced resilience, increased vitality, and a longer health span are right under your nose. Thank you.